Mary Rose, I have to tell you how thrilled I am to be a part of this advanced practice nursing team. The clinical meetings is the piece that really grabs a hold of me, because we have nurses in here. Every nurse in these clinical meetings where we discuss all of our clients have a minimum of 30 years of experience each.
Well, I'm so proud that our nurses, our geriatric care managers, have extensive experience and skill in psychiatric nursing as well as medical and surgical nursing. We have taken care of many people with Alzheimer's, which is, well, you know, is a form of dementia, as well as medical and surgical problems such as heart, COPD, orthopedic conditions, multiple sclerosis. We have taken care of so many different disabilities.
It's such a broad scope of knowledge, and that's what enables us to excel and to keep folks out of the emergency room and out of the hospitalization.
Well, we developed our model of care based on a small assisted living my partner and I've had, and we took this model of care and applied it to Ivory House Care Management, or Ivory House Health Services. And we really have a holistic approach to taking care of our clients.
We've become the eyes and the ears of the physician. It makes the physician more comfortable when he has someone that's very sick and wants to stay at home. And it certainly makes the client and the family more comfortable that we've established that liaison relationship.
And you know, we work very extensively with families, and we involve them in the care of the client. We sort of develop what we call a new normal for the client.
I draw from a personal experience. That's why I'm so passionate about the role with Ivory House Health Services. My parents were both ill at the same time. They were in two different places for a period of time. And I had to hire an agency that could look after them. They don't live locally. So my only regret is that they're doing well now, but my only regret is that I didn't have access to Ivory House because of where they live.
Besides having such skilled nurses, we have excellent aides. And we work with the aides, as you know, so carefully, and helping them to understand our written care plans and supervising them in the home. And remember, we're an agency, not a registry, which I think is very important to the client and really helps in the overall care of the client.
It makes a big difference when they're on staff for Ivory House Health Services instead of contracted.
Sure.
They have more ownership and they establish a closer rapport with clients and their families. We received a note, I think I've shared it with you yet, from Dr. B's family, and it basically says that we've made our participation made an unbearable situation bearable and even lovely.
Yeah, it's so great to get notes like that. A couple weeks ago I got an email from a daughter who was so happy that we were able to provide such good care to her mother, and it really made me feel good.
Well, it gives families and clients peace of mind knowing that we're available 24 hours a day, 7 days a week. They can always access us through, it's after hours, after business hours. They can always access a nurse to talk to. And since we have these clinical meetings, all the nurses know all of the clients. So we can triage problems 24 hours a day, 7 days a week.
Wasn't that what you were doing at 1 o'clock last night?
Indeed it was.
It's so nice to have a nurse like you so committed at Ivory House Health Services. Thanks, Michele.
Thank you. I'm proud to be a part of this team.
Thanks.